Hey, what's up everyone? Welcome to Asylums Uncovered, where we discuss the influence and impact of state hospitals on American history and the void left in their absence. How do clinicians diagnose a mental illness? Today, it usually involves a thorough assessment using DSM-5 criteria, reviewing medical history, interviewing the patient, and observing behavioral patterns. Sometimes additional lab work is ordered if needed. But to what extent is that process subjective versus objective? How reliable are those diagnoses? And could a clinician accurately detect if someone were feigning psychosis? In the 1970s, a Stanford University professor set out to answer these questions by recruiting a group of individuals to fake mental illness and be committed to state hospitals, only to then act completely sane once inside. The goal was to test the accuracy and validity of psychiatric diagnoses, and this became known as the Rosenhan experiment. But what happens when the study itself ends up being the one in question? I realize I haven't put out an episode in a couple months, and that is because I've been dealing with an inflamed disc in my back, which has been causing me a lot of sciatic nerve pain. And if you've ever dealt with sciatica, you know how excruciatingly painful and debilitating it can be. So I just really wasn't in a place where I felt like sitting down and recording anything. But thank you to an amazing chiropractor and some physical therapy, I am on the mend now. And this episode is really informative. It's really important. So even though I'm still not feeling 100%, I wanted to record this and get it out there. Stanford University is no stranger to controversial psychological research. You may be familiar with the notorious 1971 prison experiment. Around this time, law and psychology professor David Rosenhan was conducting his own research looking into if psychiatrists could tell a sane and insane person apart. And Rosenhan asked, at its heart, the question of whether the sane can be distinguished from the insane and whether degrees of insanity can be distinguished from each other is a simple matter. Do the salient characteristics that lead to diagnoses reside in the patients themselves or in the environments and contexts in which observers find them? Fair question, right? Around this time in the late 60s, early 70s, there were two beliefs. One was that a mental illness would clearly present itself and would be obvious, much like you would be able to tell a physical injury like a broken arm. And the other was that a clinician's own bias or interpretations influenced a diagnosis. For example, you could have 3 different psychiatrists observing the same patient and all come to different conclusions. A blood test can't tell you that someone has schizophrenia like it can tell you they have cancer or are anemic. Doctors rely on symptoms, what they can observe, and a medical history from the patient. Are psychiatric disorders so black and white that anyone diagnosing would come to the same conclusion, or is there a level of subjectivity, or is it a mix of both? Rosenhan wanted to find out. So he gets a group of people together, 9 in total. 8 people plus himself, known as pseudo-patients, would feign insanity and get admitted to different psychiatric institutions across the country. One of these was not included in the published study due to not sticking to the guidelines, so there ended up being only 8 reported total. Faking insanity to get committed voluntarily seems crazy and dangerous, right? But there were people out there bold enough to do just that. One of the earliest examples of this was in 1887 when 23-year-old reporter Nellie Bly was committed to the women's asylum on Blackwell's Island in New York, all for the sole purpose of exposing the horrid conditions there. And I did a whole separate episode on this and will link to it in the description if you would like to check that out. Let's get into the Rosenhan study itself. There were 3 women and 5 men. There were 3 psychologists, a pediatrician, a psychiatrist, a housewife, a painter, and a psychology graduate student. Those who were in the mental health field used a different occupation to avoid any special treatment. All 8 pseudo-patients presented the same symptoms, that they were hearing voices, repeating the words thud, empty, and hollow. They kept their real first names but used different last names and mostly stuck to their actual life histories. The real names of institutions they were committed to were also changed in the published study. Once inside, the participants would act totally normal to try and convince the staff that they shouldn't be there, hoping that someone would recognize that they were not actually mentally ill. They needed to have the same symptoms and criteria to get admitted to keep the study fair and consistent across the board. There wasn't much preparation that went into this other than Rosenhan teaching teaching the others how to cheek or hide medications, only to spit them out when the nurses weren't looking and flush them down the toilet. The participants of the study were as follows. Pseudo-patient number 1 was David Rosenhan, but he went by the name David Laurie. He pretended to be an economist and was admitted to Billington State Hospital for 10 days. Pseudo-patients 2 and 3 were husband and wife John and Sarah Beasley. This was the psychiatrist and one of the psychologists. John was first admitted to Carter State Hospital for 3 weeks and then to Mountain View for 2. Sarah was in Westerly County for 18 days. The fourth was John's sister Martha Coates, who was a widow that posed as a housewife and spent 2 weeks at Kenyon State Hospital. Husband and wife Laura and Bob Martin were pseudo-patients 5 and 6. Laura was a painter and was admitted to the only private institution in the study. She spent 52 days there and was the only participant who received a different diagnosis than the rest. Bob was a pediatrician claiming to be a medical technician, and I could not find exactly where he was admitted and for how long, so if you have that information, please send it to me. The seventh pseudo-patient was Carl Wendt, a businessman turned psychologist. He actually went undercover a total of 4 times. The first time was in Memorial County Hospital for 13 days, Rice State for 31 days, Godwin State for 19, and then finally Montedero Hospital for 13 days. And the 8th and final pseudo-patient was Bill Dixon, a graduate student from Texas who spent about a week in Alma State Hospital. The experiences and findings from this study are muddy at best, and we will get into much more of that a little later on. All pseudo-patients were diagnosed with schizophrenia in remission, except for Laura Martin, who was declared to have manic depression, which we now know as bipolar disorder. So what does schizophrenia in remission mean? Basically, it says that the symptoms were not presenting or interfering with behavior, which makes sense considering they weren't actually schizophrenic. Even though each person spent a different amount of time institutionalized, the average stay was about 19 days. Altogether, they were given around 2,100 doses of antipsychotic medication, including heavy-duty drugs like Thorazine. No staff ever caught on to what was going on, but many of the other patients did. They even accused the pseudo-patients of being investigators or reporters, which is wild that they could see that they didn't belong there, but the staff was totally oblivious. Once they were given the label as a schizophrenic, the staff didn't see them as anything else. It was like they had tunnel vision. Normal behaviors like writing were twisted and viewed as something odd. If they were in another setting other than an asylum, it wouldn't have been viewed that way. So the conclusion of the study was that no, psychiatrists could not tell the difference between someone suffering from a true psychosis versus someone who was not. And clearly, they couldn't tell if someone was faking. Rosenhan published his study titled On Being Sane in Insane Places in Science magazine. This is a peer-reviewed academic journal of the American Association for the Advancement of Science and is a highly regarded publication. This really validated Rosenhan and the work that he was doing. What may surprise you is that before his official study, Rosenhan actually went undercover by himself at Haverford State Hospital. This was an actual institution outside of Philadelphia that operated for about 3 decades before closing in the late 1990s. In 1969, Rosenhan was teaching an abnormal psychology class at Swarthmore College in Pennsylvania. His students felt like they needed to gain experience inside a hospital because how can you tell what a psychosis actually looks like until you've seen it? And then Rosenhan thought, well, why not just become the patient? Initially, he was going to include his students in his undercover operation, but he wanted to first go in himself to weigh the risks and benefits. Only the superintendent of the hospital knew that Rosenhan was incognito. None of the other staff knew. This differed from the circumstances in his published study where no one knew at all. Rosenhan created his pseudo-patient named David Laurie. He initially called Haverford saying he needed help, and they advised that he come by the next day for an evaluation. He did, and he was seen by Dr. Bartlett, the attending psychiatrist. Rosenhan told him that he was hearing voices, and after about 30 minutes, he was diagnosed with schizophrenia, schizoaffective disorder, depression, and was admitted. 30 minutes? Was it really that easy? After 9 days at the facility, Rosenhan was discharged. His time at Haverford was not officially part of his study and the findings published in Science magazine, and I want to be clear about that because I just wanted to mention that he had done this this once before. The study had a massive impact on the field of psychiatry. To this day, it is one of the most cited papers in psychiatric history. Around the time of its publishing, the public didn't have great trust in psychiatrists. We were coming off the heels of things like the lobotomy, the push for deinstitutionalization was ramping up, and this certainly did not help. To put it plainly, it made a mockery of the profession. People had the impression that doctors weren't qualified and didn't know what they were doing. But with this came much criticism of the study and Rosenhan as well. For starters, he was only a psychologist, not a psychiatrist, meaning he didn't have a medical degree. Early in his career, he had only spent a few months in a hospital for research, but never treated patients directly, so he was never diagnosing people himself. So truly, who was he to judge others diagnosing? People said he was invalidating the field and fear-mongering, and they took this personally. Raising the question of how valid a diagnosis isn't wrong, but it's how he went about it that's the problem. One person who dug into the validity of Rosenhan's study was Susannah Cahalan in her book, The Great Pretender. And if anyone has a firsthand experience of a misdiagnosis, it's her. In 2009, it turned out she had autoimmune encephalitis, which is a type of brain inflammation that can cause hallucinations. Before one doctor dug deeper and ordered the right tests, others had told her that she was schizophrenic. She later said she was incredibly grateful to have both good insurance and a doctor who was willing to look beyond the initial diagnosis. There was a very real chance she could have been admitted to a psychiatric hospital and treated for a psychosis she didn't actually have. After going through that herself, Rosenhan's study really caught her attention, so she started looking into it more closely, and what she found is pretty shocking. After Rosenhan died in 2012, his archives were passed on to a colleague, and Susannah was able to dig into them and speak to the people who actually knew him. After the study was published, Rosenhan more or less faded from view. He had a book deal lined up and even completed a manuscript, but he never sent it to the publisher. And it raises the question, well, why stop there? With all the attention and notoriety his study received, why not follow through and publish the book? Let's get into the questionable items that Susannah uncovered in her research. First was Rosenhan's reported data and findings. He wrote that all patients had been released in remission. This means they no longer needed inpatient care at a hospital and that their symptoms had either lessened or had been eliminated. But this wasn't actually the case. Bill Dixon, the 8th pseudo-patient, was just released, not in remission. So why didn't Rosenhan report this accurately? Some of his reported data seemingly came out of nowhere, like when he listed percentages of time spent on wards or in certain areas by staff. The pseudo-patients never reported giving him those stats, so where did he get them? Secondly, the parameters of the study were sketchy and the risks were high. In his first time going undercover, Rosenhan made sure that the superintendent at Haverford was aware of what he was doing. This automatically built in a safeguard for him because the person running the institution knew he wasn't insane and didn't actually belong there. Rosenhan never took that precaution for himself or anyone else in the official study. He reported having writs of habeas corpus in case they were needed, but that was also a lie. And why was a writ of habeas corpus so important here? It was there purely to protect the participants. Since the hospital superintendents and staff had no idea the undercover study was happening, this legal document could be used to challenge the patient's detention if necessary. In a way, it served as a backup safeguard if things went wrong. One of the biggest criticisms was why had Rosenhan not included the 9th pseudo-patient's data in his study? Harry Lando, who went by the name Harry Jacobs, was institutionalized at the U.S. Public Health Service Hospital in San Francisco for 19 days. This is the actual name of the facility, and Harry reported very positive things about the hospital. He said that staff were respectful, the facility was bright and clean, the patients engaged in group therapy, and they even took day trips to the beach. Rosenhan's reasoning for not including Harry in his official study was because he falsified facts about his personal life where they were supposed to use their actual backstories. But critics think he wasn't included because he didn't have anything bad to say about the hospital or his time there. Rosenhan himself had falsified facts and strayed from the agreed to narrative. Although not part of the official study, when he was admitted to Haverford, Dr. Bartlett's notes document that Rosenhan said he could hear people's thoughts, was sensitive to radio signals, and had thoughts of unaliving himself. He was supposed to present with one symptom, hearing voices that said thud empty, and hollow. But he clearly took it further. Threats and thoughts of self-harm would have been grounds for immediate hospitalization, so he gave Bartlett no choice but to admit him. Again, although his time at Haverford was not part of the official study, I think it speaks volumes to how he could manipulate the data. Why was he skewing the findings for his official study? Susannah came to the conclusion that Harry's experience didn't match Rosenhan's thesis that institutions were uncaring, ineffective, and even harmful, so they were just discarded. What she also found out digging through the archives was that he didn't adjust overall numbers for his study after omitting Harry for length of stay, number of pills given out, and so on. He was also accused of picking locations that were less desirable and were known to be understaffed. In fact, it said that one doctor at a very prestigious institution offered his facility and that Carl, pseudo-patient number 7, was to go there. But unfortunately, he came down with the flu and Rosenhan never sent anyone in his place. Why was that? The name of the doctor or the hospital were never released, but the thinking is that the experience at this facility would have been positive and not reflective of the narrative that Rosenhan wanted to portray. What is interesting is that he used the pseudonames of the participants in his personal notes. Now, I understand using them in the published study to hide identities and keep anonymity, but why in his own files? Susannah wanted to track down any participant she could to find out more. She was able to find and meet pseudo-patient number 8, Bill Dixon, who was actually Bill Underwood. He confirmed he was indeed part of the study and that Alma State Hospital, where he was admitted, was in fact Agnew State Hospital in Santa Clara. During his intake, it took less than a half hour of talking to the admitting psychiatrist to be diagnosed with schizophrenia, and then he was case 115733. When he was finally discharged, he just told the hospital that he wanted to leave. And it's a little unclear of the circumstances around this, but I think the key takeaway here was that in less than 30 minutes, he was diagnosed and admitted. Susannah was not able to find all of the participants in real life or proof that they even existed. As she's digging into the files, contacting leads, and analyzing every detail, it's becoming apparent. Did all of this actually happen? Were each of these pseudo-patients even real? Rosenhan claims that he paid for all of the hospitalizations in his study to avoid insurance and other complications, but remember, pseudo-patient number 5, Laura Martin, spent 52 days in a private psychiatric institution, which would have cost a fortune. Where did Rosenhan find the money for that? Could this be why he never completed the book? But on the other hand, his study was already out there, so what would be the harm in doing the book? Regardless, he never finished it, and the publisher actually sued him because he never fulfilled his obligation. But given that the study was published in such a respected journal, how did something that may have been flawed or even misleading get through? The exact review process isn't fully clear, but some have suggested it may not have been as rigorous as one might think. Others think it's because the journal covered a broad range of topics, not just psychiatry, so the paper didn't get the same level of close scrutiny that it might have gotten otherwise. A lot of colleagues said they were suspicious of Rosenhan, but others said there was no way that he would fake his findings. So what was the truth? Honestly, we will probably never know for sure. What we do know is this study today would have almost never happened because getting a bed at a psychiatric hospital is so difficult. There's a lot of reasons, insurance being a big one, what can be billed for, the actual number of physical beds available. Basically, you have to be presenting harm to yourself or others to even be considered. Rosenhan's study raised a great question of the validity of a diagnosis, but unfortunately, the specifics around it leaves more questions than answers. I am not able to fit every single detail here into this episode, but I highly encourage you to read Susannah's book, The Great Pretender. All right, everyone, that's it for me today. Thank you so much for listening, and until next time.